Tamil Nadu politics will perhaps never be the same. I also caught up with Preetha Reddy, Vice Chairperson of Apollo Hospitals. Remember, Jaya had been admitted at Chennai's Apollo Hospital since the 1st of September. I started by asking her about the experience that the Apollo Hospitals has had to go through over the last 75 days in trying to restore calm and order. Remember, outside the gates of the Apollo Hospital for those 75 days, you've had people thronging, just waiting to hear about the former Tamil Nadu Chief Minister's health, for information about her well-being. So here's Preetha Reddy on what transpired over those last 75 days and Jayalalitha's economic legacy.
First, I must say that, you know, it's been devastating. The loss has been devastating for me personally, for the Apollo family, Dr. Reddy's family, and the whole of the Apollo team, because we really, in the past few days, she was with us, past few months, we really grew to respect, love, and admire her as a person, and understand and appreciate the kind of work which she has done for the state. You know, she's just given her entire being for the masses of Tamil Nadu, and really made Tamil Nadu, especially in the area of welfare, a model for the rest of the country. And I must start off by saying it. I wouldn't be speaking the truth if I said that it was, you know, calm and easy treating somebody of her stature. But I will also say that, you know, the system around her has been so supportive and so professional in the way that, you know, they allowed us to treat the person, to treat that individual. And I really admire her, either her family members or the you know, the team of the officers who were constantly there 24/7 round the clock, and her ministerial colleagues. Everybody was like in total silence, no problems in the hospitals, allowing the doctors to do exactly what they think was right for her. And I must say, you know, a big thank you to them for allowing us the opportunity to treat her. It is sad that, you know, the outcome was not, you know, what any of us wanted. And to me personally, and for the rest of the team at Apollo, who worked so hard, who worked tirelessly to see that our Chief Minister is back in action, and it did not happen. It was a hugely humbling experience for us. It was devastating, it was humbling, and it makes all healthcare professionals realize that you have to do whatever is focused, highest levels, highest standards of care. But at the end of the day, it's the hand of God who really, you know, designs the outcomes. And I think that it broke our hearts. It was so hard for us to come to terms with it, because it was unexpected. We thought she was going to go home, and it didn't happen.
But
so
did you? Did you really, Preetha?
Not only for us, but to.
I'm sorry to interrupt you, but did you really think that you know, because even on the day that she suffered the cardiac arrest, there was a news flash that came in from a news agency that said that the doctors from AIIMS had actually cleared her and said that she was fine, she could go back home. And then about an hour or two later, we heard about the cardiac arrest. Was she really in a position that she could have left the hospital before the cardiac arrest? And I don't mean to you know, to sort of get you to divulge details, but you just spoke about how you felt hopeful that she would actually be able to walk out of the hospital and head back home.
I think, you know, as I said, in the South we look for good days to do things. I think the family was looking for a good day to go home. She was talking on Saturday. So if all had gone well, she could have gone home. But I said, you know, God decides, man proposes, and God disposes. So we need to, as healthcare professionals, we need to realize that there is only so much we can do. And, you know, I think it was probably the most devastatingly humbling experience ever for all of us.
Preetha, you know, you talked about her welfare economics, and we've got, you know, these graphics that are running on our screens of the kind of populist measures that she has sort of taken forward during her tenure as Chief Minister, not just this time around, but previously as well. But from an administration point of view, from as a corporate citizen, what do you believe her economic legacy will be?
Shereen, she was a good friend, and she would talk, and she was an extremely intelligent individual. I mean, you would never think that she didn't even finish school. She was completely with it with the numbers, and she, I think, had her eyes on the economy of the state. She worked very hard to see that it could become robust. And having said that, I think the welfare measures which she did had their economics right. And if they had been allowed to run alongside with the rest of the plan she had for the state, in the remaining 4 years, I think Tamil Nadu would have done extremely well from both sides, from an industry's perspective, from an economic perspective, and from a welfare perspective. And she had some fantastic officers working with her, and she would listen. She would listen, she would analyze, and she would focus, and that's her innate quality. And she's done a lot.
Preetha Reddy, we now have a new Chief Minister in place. Again, as a corporate citizen, as someone who has business interests in the state, what is it that you would like to see in terms of continuity?
So, this is what a lot of us in Tamil Nadu feel, that Amma Jaya was a leader, a great leader for the masses, and she had the charisma and the leadership quality for the masses, and she could do a lot. But I think tomorrow's leadership has to be about governance, and we can still achieve a lot, but I think we'll have to do it from just high standards of governance, high standards of procedures and systems, and with a consistent focus on outcomes and raising the level of economic sustainability for the state.